Welcome to The Bridge, a podcast on how leaders use data to make decisions in the military community. I'm Shannon Razsadin, the CEO of MFAN and also a military spouse. The Bridge is your go-to source for informed conversations about the programs, policies, and lived experiences that shape military family life. We're highlighting the voices and the stories that are making a difference, and we're grounded in data and driven by purpose. The Bridge podcast is produced by Rocket Data. Thank you all for being here, and let's jump right into the next episode. So today we are joined by a truly remarkable team. As everyone knows, the government shut down for about 6 weeks, and during that time, there was an incredible amount of instability that we saw in the military space. One of the things that it really punctuated for us is that so many military families are unfortunately living on this bubble of just getting by, just getting by, just getting by. And the risk of delayed pay or missed pay put them in a full situation where they would not be able to put food on the table. And so for MFAN as an organization, we've had incredible partners that we've built over the course of several years. And we decided that we were going to lean into this moment and do everything that we possibly could to make this happen. But we could not do it without our partners being willing and able to rise to the occasion with us and make that happen. And so before we jump into the conversation, I want us to do a quick round robin with everybody here so that you can introduce yourself, what organization you're with, and then we'll kind of get into the magic that happened just a few weeks ago. So Todd, I'll start with you.
Thanks, Shannon. Well, hello, everybody. I'm Todd Avery, CEO of Umoja Health. Our work focuses on advancing health equity through access and community-centered support, especially during the moments of crisis like the one we just had here with military families and the shutdown. And this conversation, as you guys know, hits me personally. My father was an enlisted Marine in Vietnam. I have a son-in-law that's combat disabled who was in the Army. And I currently have a son-in-law that is an active duty fighter pilot in the Air Force over, I can't say where, but not here.
Yes, please don't do that. We don't want to break OPSEC.
No. So when I got a chance to partner with you guys, MFAN, there was no hesitation.
We love you. You are incredibly humble in how you talk about the work that you all do, but it's truly nothing short of Herculean. And during all this, I loved being able to see everything happening real time in your warehouse, and just what you've built and what drives what you've built it's awesome. And so thank you. Rebecca, why don't you go ahead next?
Hey, I am Rebecca Grimes. I'm the Chief Revenue Officer at Sheer ID. And here we are the leading provider for engaging and verifying high value audiences. So, to break that down, at our core, we help brands create this deeper connection with their most valuable and loyal audience. And we achieve this by verifying the eligibility of a member to be a part of that key audience, things like students, healthcare workers, and of course, military personnel. And we were very fortunate to work with organizations like MFAN, the Home Depot, and OpenAI, who are deeply committed to the military community and recognize their service by providing special offers and support. And we were ready to jump in action once we learned of this opportunity to quickly mobilize our teams to get a program up and running so that the service members actually had access to the services that were available at this time during the shutdown.
Thank you so much. And, one of the things that was so important for us when we were doing this is how can we make sure that we're really serving the people that we are intending to serve here? And so what you all were able to do with us, and frankly, not just give us peace of mind, but our supporters peace of mind, that was incredibly, incredibly important. Delia, my partner in crime, go ahead.
Everyone, I'm Delia Johnson, the Chief Operating Officer here at the Military Family Advisory Network. And this is personal to me. I grew up in a military family. My spouse just recently transitioned out of the active duty into the retiree status from the Air Force, and we're still navigating that. And so for me, when the shutdown happened and we started to see the just overwhelming and immediate need come very, very quickly, Shannon, myself, the other members of our leadership team, our board, our incredible team, all said to ourselves, what can we do? And we wouldn't have been able to answer that call without partners like Sheer ID and Umoja Health. So I'm just thrilled that we're all here today to kind of talk through that partnership and the effort that we were all able to do together.
I love it. And to that point, This is personal, right? For so many of us, Todd mentioned that it's just, Delia, you've heard me say this ad nauseum, but for MFAN, it was like when we put our head down on the pillow at night, how do we know that we did everything that we possibly could? And so, Delia, going from that, like when we saw this bubbling up, talk to us a little bit about, because ultimately, you, me, and our chief advancement officer sat down. And it's like, okay, the three of us have to be on the same page because it takes all these different levers for us to be able to make this happen. Talked a little bit about kind of what your steps were and how you made this possible.
Yeah, it's a great question. You got to love when you have a CEO who's a dreamer like Shannon who comes to you and says, "So, Delia, if we were going to go nationwide with our program, like, how, could we?" And I love that she came to us and said, "Could we?" And I said, "Yeah, we could if." And there were two big ifs. One was, can we verify military status? As Shannon already mentioned, we are an organization who our mission is to work with the military family. So we needed to be able to verify that status. And luckily for us, we had already started working with Sheer ID on scoping out some work for an existing program that we have, the PCS Pantry Restock Box program. And so we were able to reach out to the Sheer ID team and say, can you do this quickly? And the answer was yes. And we'll get into that more further in the show. But then the next question was, okay, but do we have the product? Do we have the logistics? Do we have the ability to actually get food in a box mailed directly to the door once we get the family verified? And that question went straight to Todd and his team because they're the logistic gurus. That's not our area of expertise. And thank goodness, Todd, you and your team believe as passionately in serving this community as we do. They said, what do you need and when do you need it by? And so I think that initial response from both the Sheer ID team, the MFAN team, and the Emoja team to be like, we need to do something. How fast can we make it happen? Brought all of us to the table in like a 24-hour window, and everybody's teams just went off like wildfire. Todd and his team made sure they had the inventory, they had the supply, they had everything set up. Members of his team canceled their vacations and went into the warehouse to design a box as quickly as possible. Rebecca and her team immediately said, okay, I know we were going to do this originally for your program. Let's flip it on its head and do this instead, and we can get it for you live in 72 hours. And we were like, all right, let's make it happen. And so from a conversation on Monday to Friday, it was, okay, we're ready. We can do this next week. And to me, that's remarkable partnership. It shows that partnership isn't transactional, or maybe I should rephrase that. Partnership shouldn't be transactional. And the folks on this call stepped up to kind of the need in the moment. And to me, that's what made this possible.
It made the magic. And I think that a lot of that comes down to the culture of the organizations that are represented here. Rebecca, can you talk a little bit, like when you got that 911 call from our team, what happened? And kind of what was the deciding factor that like, yeah, we can do this.
We understood that the shutdown would really create some financial strain for military families and other low income families that we also support with some of our brands. But we expected it to really look similar to past disruptions. We knew that delayed paychecks would force families to make those difficult trade offs. We didn't know how immediate and how long that this actually was going to be. So, once MFAN started sharing that they were hearing from families, the picture just changed for us. It was all hands on decks. It became clear that this community was really facing these urgent challenges that required us to move quickly, a coordinated effort, and that digital identity verification could serve as that reliable foundation of trust to really getting help in front of the people who needed it the most.
Love that. And, one of the things that we had been talking internally about is working with you all in a much more strategic way in 2026. And so when Delia and I were having conversations, it was like, okay, the things that we were talking about doing next year, like, can we move these left? And can we make it happen? And just how fast you guys were able to come alongside us with that. Because, like I mentioned before, it's one, from the efficacy of the program is perspective, we need to make sure that we're reaching the right people. but also like the trust of the funder who really enabled this to happen. I mean, this is an expensive effort, providing $200 worth of groceries and shipping it to families so that it's a dignified solution, is just something that was really important. So we had such confidence, and when we went to our partners and say, "Oh no, we're working with Share ID and they are verifying every single military family recipient," that helped our partners exhale a little bit because they knew that their hard-earned dollars were going to the right places, which was just so important. Now, Todd, so you mentioned this a little bit during your opening, but you do a lot around WIC, you do a lot around emergency grocery support broadly. How was this unique, or how was this the same from things that you've done as an organization to serve other population groups? And was there anything that surprised you with this?
Yeah, well, we respond to hurricanes, floods, wildfires, you name it. What surprised me was the shutdown of the military is different because you have FEMA, you have the Red Cross, you have local churches when there's a natural disaster, and they automatically, there's a procedure for that. And in the shutdown, military families had no idea who to turn to. And I think, fortunately for MFAN and other nonprofits that focus in the military space, were there to help. And so that's what's surprising is we don't have FEMA for when the government shuts down, and it was a big surprise to me that we didn't have anything. And for me, I wasn't aware that it wasn't top of mind that military families weren't going to get reimbursements or paychecks or any services that they typically do. Because when you hear the news, you hear government employees are not going to receive pay, but it'll be back pay. It's controllers, it's other employees, but our military are employees of the government, of our government. And what surprised me is there was not any talk really until you guys came into the picture and we got that phone call from you. So that's what was really surprised me.
You make that phone call sound so delicate, and I'm sure it was not so delicate. I'm sure it was so guys, how can we but no, you're right. There was a lot of information gaps and knowledge gaps and fractures, I think, that were exposed in this shutdown. We convened a group, our Military Family Financial Readiness Coalition, and we were talking just about how do we prepare for what we don't know as far as what could happen in the future? Where are those lessons learned? We have to make sure that we take the time to do that after action report so that we can learn from this. And I think that one of the things I personally really learned, and when we saw that over 50,000 verified, thank you, Share ID, military families come in, like in 72 hours, it was a bit of a gut punch from a variety of perspectives. One, like, how the hell are we going to meet this moment? But two, oh my God, like a delay in pay would put this many families in this situation. And if we had kept it open, God knows how many we would have had requests for support around. And so part of what was so important for us is being able to triage how we were responding, and Share ID helped us do that to make sure that we were getting the support to the people who needed it most. Because the Guard and Reserve community, they missed those drills. And so they had a real tangible gap in pay that has a ripple effect. So they're counting on that pay that comes after their drills to be able to buy the gas, to be able to go to their 9 to 5 job that happens Monday through Friday, or to be able to pay for the childcare so that they can go to that. And then one of the other things too that really caught people off is the delay in moves that people experience and what the consequences were for families as it relates to that, because they had planned to be out the door and in a new house. And it's like, oh, just kidding. We're not moving right now. And that has some real financial ramifications. Delia, like as a military spouse, once a military spouse, always a military spouse, what were some of the things from like that ripple effect perspective that caught you off guard in all this?
I love that you say once a military spouse, always a military spouse, but here I am, post retirement, still learning like the impacts of things like this, the ripples, as you talked about, Shannon. And for me, I think When I first heard kind of those ripple effects coming out, it was things like, I can't get access to the insulin that my child needs because the federal employees who usually staff our military treatment facility aren't at work and aren't getting paid, right? So they were furloughed. So, like, those were connections that even I, as a military spouse, hadn't made. So I think for me, Shannon, those were the first kind of eye opening, just caught me off guard types of things as a military spouse. So that's one really key example was access to prescriptions and also medical services and referrals. I think the second big one we heard, and again, I should have connected the dots on these things, were things like, we have just PCSed and we're waiting for our reimbursement. So folks who don't know, when you do your own move, what we call a Diddy move kind of in the military, you get reimbursed on the back end, and it can be 5, 10, 15, $20,000. Like, these aren't small amounts. And these families fronted the money and were waiting for the pay. So, we kept hearing on the news, and Todd, I love that you mentioned that. Folks were like, oh, well, they're going to get paid. They're going to get paid. But these second and third order effects were impacting these families' financial situation immediately, such that they said, okay, we're going to have to get food support and grocery support, so that $150, $200 we would have gotten, towards our grocery bill, we can now get this incredible box thanks to these partners and put that money towards these other immediate things that hit those families' budgets right out the gate. And Shannon, I don't think that was really well understood, even amongst the military community, these second and third order effects. And I think for me, the biggest learning lesson, and what I take on as a challenge for what we can do in the future, is there were fractures in the system that we now know about. What are we going to do to make sure this doesn't happen again?
It's so true. And like, you can control and try not to worry too much about the things you can't control. Well, that's just not possible. Frankly. When you're living on this bubble of just getting by, and like, one thing goes out of whack, it really throws everything out of whack. And that's what we saw for so many families here. And it was a real education process. Every conversation that we had is like, oh, well, they're going to get paid. Okay. But imagine all these different things converging at the same time. And like, the other reality here is, like, military have to maintain a security clearance, right? And if you're in a situation of financial duress, that impacts your security clearance. And so, like, it just keeps cascading, and it's like this hamster wheel that you can't get off of. And so it was really interesting. And Rebecca, like, you guys handle large scale verifications frequently, right? Was there anything, similar question to what I asked, like, was there anything about this that was like, wow, this is a little bit different, or this is a little bit unique, or I had no idea, that you guys learned going through this?
We've worked with the military community for more than a decade. It's something that we are very proud of our origin in the way that we have serviced the brands through the years. But specifically, the sheer volume was significant. But what really stood out the most for us was just the urgency behind every request. We pride ourselves on making sure that that verification is trustworthy, but also that it isn't a delay, so that, with limited quantities of, boxes to go out, that everybody who was eligible had access quickly. And so that was the difference in shift in the team's responsibility internally to make sure that not only did we set this program up swiftly, but that it was done correctly, and that the rapid increase in request really was addressed by our teams with staffing shifts and changes, but also it just really validated the importance of the work that we do to really support programs like the one that was most urgent at the time. And obviously, we have programs that run every single day, but this one definitely felt different for our team members, many of whom are actually military members or family members themselves.
It's that's such a good point, and I know, Delia, you can probably expand on this even more than I can, but those quotes and what people told us and the vulnerability that they shared in this was unlike anything that I personally, in the 13 years of MFAN, have ever seen. We've seen a lot. Like, we did the Million Meals Challenge, we distributed a ton of grocery support over COVID. This was different, though, and I had a conversation recently around why was this different, and I am having a hard time coming up with the exact words around this, and so bear with me as I fumble my way through this. But I think, similar to COVID, when people were asking for grocery support, it wasn't necessarily their fault. It wasn't a money mismanagement situation. Like, it was a great equalizer as far as a lot of people needed a lot of help. For this, I think that taking the onus off of military families from like financial mismanagement or whatever it might be made it much easier, lowered the barrier to entry for people to ask for help. But I don't think it's unique. And I don't think that this is just shutdown related. I'm so glad we were able to surge and meet the moment, but holy moly, it punctuated how fragile the financial situation is that so many military families are living in. And that's not good from a lot of perspectives. That's not good from a national security perspective. That's not good from the future preservation of the all volunteer force, because we know that that lies in military kiddos. And so one of the things that we will be doing is bring the information, those lessons learned, the things that we heard to the Pentagon. We'll be bringing it to banks. We'll bring it to different places. We don't know as far as future shutdown or what families might have to go through, but we know that on a good day, the financial situation for far too many is fragile. Todd, I want to go to you next. One of the things that was most humbling for me when I visited your warehouse in Houston is like you could tell that people who were packing those kits cared, right? And it was very thoughtful. I mean, I get emotional just thinking about it, but like it was something that seeing the scale of what we were able to do quickly because of you all and because of the people there who stepped up, it was remarkable. Can you talk a little bit about that and like those mission moments that you guys have? Because it really, it, I got it tangentially, but I got it at a way different level when I had the ability to visit you guys.
Yeah. Well, when you guys called, we flipped into disaster response mode, instantly, and we expanded the warehouse shifts, and our team didn't hesitate. They wanted to help right now, and they're really good about that. They, a lot of them, like most American families, have connection to the military family, and right away they were like, "Yep, we're here. We'll work around the clock." Uh, some of those messages from the families that you shared with us, what stood out wasn't just gratitude, although that was moving. It was relief. It was, these weren't just groceries. It was like reassurance. And our team was happy to do that and wish they could have done more. I mean, you said you had 50,000 families. I wish we could have serviced every one of those, and we would have if we could.
Yeah, and that's one of the things that I think has been gutting related to this is there was desperation. There was true desperation that these families were experiencing, and we are almost mid-size, I think we can say, nonprofit. We don't have all the resources to be able to do all the things. And for us, it was a question of, all right, let's do as much as we can, right? And we would not have been able to do as much as we could had you all not rallied with us. And so part of what we are trying to do and prepare for as a team is like, all right, we've got to get to a point where we're not raising the money while trying to deploy the support. And that is a broader conversation around just how nonprofits are funded, right? And like being able to have those reserves to be able to meet those moments and not sitting on them, but really using them for how the dollars are intended based on your mission. Delia, like we're going through the budget process right now, but what are some of the things that we would like to be able to do in the future? Again, not knowing what's coming January 30th if we're going to have another shutdown, but kind of what have you learned as our COO and how we can meet these moments?
How much time do we have? No. In all seriousness, I've spent my entire career in the nonprofit sector, and I think what Shannon just shared isn't a new thing. I think, and again, I can get on my soapbox in terms of trust-based philanthropy. This isn't the podcast for it, but I think there are funders out there who understand it's important to have things like innovation funds, like response funds. One of my past CEOs used to call it the do the right thing money. Like this is the money we all need to have. And in the nonprofit sector, that's how we work, is we are funded for our mission and for our programs and for our research. And so I think, Shannon, in terms of what I've learned is it behooves the whole nonprofit sector that as you're building budgets and as you're looking through your 2 and 5 and 10-year strategic plans, is making sure you are setting aside whatever you want to call it, the rainy day fund, the innovation fund, the do the right thing money. It's imperative that we all do that, because if all of us in the nonprofit sector that are serving military families had done that, have been doing that, will do that, the next time this happens, It's a matter of picking up the phone and saying, how much do you have in your fund? Let's pool our funds. Let's get Cheer ID on the horn. Let's get Emoja on the horn, and let's do some damage. Like, let's hit all 50,000. And so I think all of us being more strategic and planning for those things. I think it's also information and education, Shannon. I think that's the other big piece about what's come out of all of this is folks were coming to us not just for grocery support, but there's another whole element here of information.
Hmm.
People were looking for information. By people, I mean military families who needed support, but also those who were serving. We had outreach from across the globe. Like, I had commanders and leadership reaching out from Japan, from Australia, from Puerto Rico, you name it, looking for information. And I think that's the second piece, Shannon, is we could do a better job as a system on how do we rally together to make sure we're giving out trusted, verified information when it's needed, and it can't be reactive, much like fundraising in the moment. We've got to be prepared. So I think there's a lot of work we have to do as an ecosystem to make sure we are prepared. And Todd, we don't have a FEMA, but we do have a network of folks who care. And I think if I've learned anything, I've learned that, and we can come together to do better.
I love it. It's leave ego at the door, right? And like get the stuff done. And because of you guys, we were able to do that. And to Delia's point, we learned a lot. And there are going to be things that we continue to learn. And like I said before, there are things that are outside of our control, but how can we plan for those, right? And part of it is now we have this infrastructure in place that not only helps us be able to flex in the emergency moments when we need to, but also from a day-to-day perspective, be able to serve families more effectively and more efficiently. So, Rebecca, thinking about that, and I know that we are excited to continue to grow our work with Share ID next year. What are some of the things that we'll be able to carry forward into next year as we think about how we support families, specifically like through the Move related program that we have?
Yeah, I mean, the the best part about what we do as a business is that we can verify against authoritative data sources in any capacity. So we do employee verification for some of our brands. I mentioned low income earlier, military families. We can distinguish active versus veteran status. There are a lot of access to resources that we get uniquely because of being this trusted resource for the world's brands. And I think that one thing, Shannon, that you mentioned earlier, why was this so different? I think for me, this was so different because the need was so great. Obviously, the military families were impacted, but the rest of communities are also navigating this food insecurity situation. And we supported a local mom who couldn't make it there, get time off from her job. It was a 3.5 hour wait, and we were number 10. Like 10 minutes thereafter they opened, we were number 10 there. And we went and filled all of our micro pantries in town and stopped by the next day, and they were all wiped out. And so I think, like, what is different now is that the need is greater than ever, and military families are equally in need, and not just in the moments of the shutdown, but just with to your point, Celia, about information and what resources are available, that we continue to challenge ourselves as a business as to what are the other audiences that folks might want to engage with and support. And our responsibility as a partner in this ecosystem is to make sure that the intended recipients get what they are entitled to, and the folks that aren't eligible are kept out of these intended resources. And we feel very proud to be able to support you and many others in this journey. But we're ready for whatever is next, because our unique position in this industry is about connecting really the data with the brands that want to engage and really need to trust in that identity verification process as a means to serving the communities and audiences that they intend to support.
That's very well said. That was awesome. Todd, I'm going to end with a question for you in particular. You all come from a place of your whole mission. Your whole mission is about leaning on what you know how to do from a corporate space, but getting it to where it's needed from a philanthropic, generosity, giving, well being, do the right thing way. Coming out of this and coming out of, I'm sure, a really busy year for you all, how do you go into 2026 and what are you preparing to do for the future?
Well, that's a big question.
I know.
So, for the future, we're going to continue to expand, getting into people that are often left behind. And what I mean by that is rural families, like military families, aren't on the top of the list. And I think that's our secret sauce, is that we are a logistics company that have a mission, and our mission is really to help people as much as we can, and we focus on where people are not getting the help they need. So that's why we have a great network where we can get anywhere in the country in 2 days. We can get to all the rural places. We can get to anywhere in the US, including any territories and things like that. But for 2026, you mentioned WIC. We're really expanding into WIC. There's a lot of families out there that just that have services available, but they can't access them. And so, like what you do, which is great, is connecting with those people with the resources, and we'd like to be that resource. So the future is bright. You're in Norfolk, Delia, and as you know, I'll probably be out there next week or the week after, looking for a new warehouse out that way. We're also looking somewhere additional one I would call Mountain West, that Utah area, just so we can service more. And 10% of the money we make goes back to the communities that we service, and we're very proud of that. And the whole team's pulling that way. So the future is bright. I wish there weren't those problems that we're helping solve, but the fact is there are, and it's our job to help get those resources to people that can't get them.
I love it. Well, in this season of giving and gratitude and all the things, you all are amazing human beings and so grateful that you rose to the occasion with us. To that point, Todd, like, wish we didn't need to rise to that specific occasion. I can bet nearly everything that I have that we'll probably need to do it again at some point. And just knowing that we have amazing people alongside us who get it and are willing to just put the work first, to be able to meet the need, like, it's very humbling. And for us at MFAN, I can speak for Delia, I think, on this. Like, sometimes the work is really hard, but doing that really hard work alongside really great people makes it a little bit easier, especially in those moments of heavy stuff. And we've had a lot of heavy stuff lately, and so to you guys, thank you so much. I really appreciate everything. Thank you to everyone who listened to this episode of The Bridge, and we will see you back here next time. Thank you so much for tuning into this episode of The Bridge. I want to say thank you again to our partners, the producers of this episode at Rocket Data. And if you want to learn more, we encourage you to subscribe and visit mfan.org to connect with us and listen to our previous episodes. I hope you have a great day.